This is Dr. Kelly Cunningham. We've had a chance to talk a bit about some of the non-surgical applications of this exciting new breakthrough technology in orthopedics, orthobiologics. Now we need to talk about the surgical applications of this technology, because there are times when traditional injections and treatments are not enough. Traditional surgery involving articular cartilage or joint cartilage involves either a cleanup procedure known as chondroplasty or perhaps microfracture treatment, which is a technique that I have extensive 20-year experience with, that involves stimulation of the marrow to provide cartilage cells to the surface of the bone. Both of these are good techniques that I'll continue to use in my practice, but I'm most excited about some of the enhancements to these procedures that orthobiologics is providing. Biocartilage is a technique where we take a matrix and put it on top of the microfracture drilling procedure, such that the marrow stimulation cells that turn into cartilage are nourished and fed in a good, proper technique involving the application of platelet-rich plasma. So when we mix these things together, we are seeing an enhanced healing of articular cartilage. And most exciting is the fact that it appears to be normal cartilage and not scar cartilage. So we think this will have a greater longevity and better applications for our athletes, especially as the years go by and they age. The second type of surgery we need to talk about is resurfacing surgery. And this is where we actually take defects to the surface of the cartilage and repair them or replace them. So we're not only relieving pain and restoring function, we are looking at actual repair techniques. These involve resurfacing techniques of Carticel, where we take your own cells, harvest them at one surgery, grow them in culture, and bring them back at a second surgery for implantation. This has been a technique used for a good 15 to 20 years. Unfortunately, it does involve 2 surgeries and is fairly costly. An alternative is called the Oates technique, or allograft and autograft transplantation. Allograft comes from donors, autograft comes from your own tissue, but it's done generally at the same surgical setting, such that you take a plug of cartilage and underlying bone and reimplant it in the affected area. And this technique is something that's been used for a good decade and has definite applications for smaller and larger lesions. And these lesions are based on size, and therefore you have pretty much unlimited potential for harvesting these cells from donors and from your own tissues. Now, it's important when you're considering these surgical alternatives that you realize each case is individual. So we want to see you in the office and take a look at your physical exam and your history and what type of problems you're having, and come up with a specific plan for you. So we'll look forward to doing that. Please check the links on our website, and they'll give you more information about all of these different surgical techniques.